Hello, I'm Dr. Sanket Mehta. I'm a surgical oncologist with a focus on cancers of the liver, GI tract, and peritoneum. If you or someone close to you has been diagnosed with liver cancer, you may have come across the term hepatectomy. It's natural to have questions about what this means, when it's done, and what the recovery involves. This video aims to offer clarity on liver cancer surgery and hopefully reduce some of the anxiety that often surrounds it. Liver cancer can be primary, meaning it starts in the liver, or secondary, meaning it has spread from another part of the body. The most common type of primary liver cancer is hepatocellular carcinoma or HCC. Another type is called cholangiocarcinoma, which can arise either inside the liver or intrahepatic cholangiocarcinoma or outside the liver, called as extrahepatic cholangiocarcinoma, involving the larger bile ducts. Whether surgery is possible depends on how early the cancer is caught, how the liver is functioning, and whether it's confined to the liver or not. A hepatectomy is the surgical removal of a part of the liver that contains the tumor. This could involve a subsegment, one or more segments, one sector, one lobe, or in some cases even extended resections if required. What's remarkable about the liver is that it can regenerate. As long as we can preserve enough healthy liver tissue, the liver usually grows back to support normal function. Surgery isn't the right choice for everyone with liver cancer. We consider whether the cancer is limited to the liver, how much healthy liver tissue is going to remain after the surgery, the liver function, especially whether there is cirrhosis or not, whether major blood vessels are involved, and the patient's overall health and fitness for surgery. Every case is carefully evaluated using scans, blood tests, and of course clinical judgment. The procedure is done under general anesthesia and can take anything between 3 to 6 hours. Depending on the case, we may remove a small portion of the tumor or one whole lobe or more, depending on the tumor size and location. In some cases, we can use minimally invasive techniques like laparoscopy or robotics. In others, open surgery is the safest choice. The goal is always the same: remove the tumor completely and preserve enough healthy liver tissue for regeneration and recovery. After surgery, most patients spend about a week in the hospital. Recovery at home usually takes around 4 to 6 weeks, and during this time, the liver continues to regenerate. Of course, common parts of the recovery include fatigue, gradual return to diet and activity, and monitoring of the liver function and healing. Risks include bleeding, infection, bile leakage, and in rare cases, liver failure. With careful planning and experienced surgical teams, these risks are closely mitigated. In carefully selected patients, yes, surgery can be curative. This is most likely when the tumor is detected in an early stage, there is no spread beyond the liver, and the remaining liver is healthy and functional enough to regenerate. In other cases, the surgery may be one part of a broader treatment plan, which can include chemotherapy, targeted therapy, and ablative techniques. Now, an important point which I want to emphasize is liver cancer surgery is never one size fits all. The liver is an incredibly complex organ. It has a dual blood supply from the portal vein and the hepatic artery, which has its several branches. It has a very complex venous drainage, when it includes 3 hepatic veins which drain into the inferior vena cava. It has also other multiple smaller veins which directly drain into the inferior vena cava. It has significant anatomical variations between individuals. And most importantly, it's an opaque organ. We cannot directly see these blood vessels or the drainage during surgery. So a precise pre-operative planning is critical for good outcomes. Because of this, for the same exact tumor size and location, 2 different patients may require completely different surgical plans, depending on the patient's liver function, the quality of the remaining liver, and the specific anatomic variations in that individual patient. Learning curve. It's also important to know that liver cancer surgery has a very steep learning curve. Studies suggest that units performing more than 50 liver surgeries per year is a benchmark of an experienced practice where the complication rates are minimized and outcomes are optimized. There are separate learning curves for major hepatectomy and minimal invasive liver surgeries, which are even more complex and require more advanced expertise and equipment. Very few centers and very few cancer surgeons in India routinely perform minimal invasive liver surgery for cancer. To give a sense of the scale, in a country like South Korea, expert liver surgeons routinely perform 5 to 6 liver cancer surgeries per day, 5 days a week. In contrast, in India, even the busiest liver surgeon rarely perform more than 1 liver surgery per day, highlighting a major gap in awareness, diagnosis, and referral. Many cases remain underdiagnosed or referred too late when surgery is no longer an option. So if you or someone you care for is facing liver cancer, here is what I want you to remember. Liver surgery is one of the most powerful tools we have when done at the right time and in experienced hands. Surgery is the only modality that offers a potential chance for cure, whereas systemic therapies, while important, primarily help only in prolonging survival. Experience, precision, and personalization matter greatly in liver surgery, And here is one more insight. Even before modern chemotherapy, in the pre-1999 era, when Japanese surgeons did not have any access to systemic therapy to treat liver cancers, they were achieving 5, 10 and even 15-year survivors for liver cancer patients using surgery alone. Today, with both advanced surgery and modern systemic therapies, outcomes can be even better. In summary, don't delay evaluation. Don't assume surgery is not possible, and always seek a second opinion from an experienced liver cancer team. If this video helped you clarify things for you, please like, share and subscribe so that more patients and families can access this vital information. Thank you for watching. I'm Dr. Sanket Mehta from SSO Cancer Clinic.